accommodations refer to any changes in the work environment that enables employees to best perform their job. There are many adjustments that can be made in the workplace that do not need to be formal accommodations. Over 50% of adaptations are free and easy to implement. These can include job coaching, adapting the environment by using routines and minimizing unnecessary distractions, and accessible communication by using written and visual supports in plain language. Like workplace disclosure policies, the accommodations process should be easy to access, transparent, supportive, and private. Under the BC Human Rights Code, refusing accommodations or dismissing an employee from a job due to disability is considered discrimination. There are 2 exceptions to the duty to accommodate. If an accommodation request presents an undue hardship, such as significant financial costs, health and safety risks, and isn't appropriate for the size of the workplace, then an employer can refuse the request. The second exception is a bona fide occupational requirement or a job requirement that is essential to completing the job safely and efficiently. Employers do not need to know what the disability or diagnosis is. All they need to know to grant an accommodation request is that an employee has a disability, how it affects their ability to perform essential tasks related to the job, and what the employee is requesting from the employer. Employers are not allowed to ask for independent medical exams in order to challenge accommodation needs or deny accommodation requests. To reduce stigma and barriers to receiving accommodations, employers can work to normalize accommodations in the workplace. It does not always have to be a formal arrangement. The inclusive workplace encourages all organizations to consider whether their accommodations policies and procedures are absent, where there are no policies or procedures in place; reactive, where the workplace reacts to accommodation requests. There may be policies in place, but they are vague or unclear; proactive, where there are structures such as policies, procedures, timelines, and documentation formats in place for accommodation requests. In a proactive space, there is a diversity, equity, and inclusion committee that brings accessibility issues to decision makers. Finally, normalized is where a workplace has implemented proactive strategies for accommodations and has made it a normal part of its organizational practices. In this environment, the leadership team regularly engages in conversations around disability and inclusion. The company collaborates with community-based disability organizations and advocates. Employees understand that accommodations are not only for people with disabilities, but for everyone to thrive at work. A study done in 2014 found that 95% of accommodation requests came from people without disabilities. These requests included a flexible work location or work hours, extended breaks, or modified workspaces. The initial response to the COVID-19 pandemic demonstrated that adjustments are able to be implemented easily, quickly, inexpensively, and can be widely applied. Instead of seeing accommodation requests as being reserved for people with disabilities who require extra support, organizations can support all employees by ensuring that accommodations, modifications, and adjustments are viewed as normal requests that anyone can make in order to effectively perform their roles at work. Normalizing accommodations can help remove the stigma attached to being different and reduce or eliminate the unfairness that employees may feel towards coworkers with additional support needs. Disabled employees are already represented within every occupation and industry, and it is simply good human resource practice and good business to provide and normalize workplace accommodations.